So we're here at ASH presenting the results of a phase 1 portion of a phase 1/2 clinical trial. This is a multi-center trial testing out KTE-C19 for patients with refractory aggressive lymphomas. KTE-C19 is a Kite-manufactured autologous cellular therapy product. After the cells are collected from the patient with lymphoma, they're sent to a centralized manufacturing facility run by Kite Pharma, where a gene is inserted into the patient's T cells, and that gene expresses a chimeric antigen receptor, or CAR, so that those T cells can be retargeted against CD19 on the patient's lymphomas. This is the same process utilized at the NCI where this therapy was developed. After we collect the cells from the patient, they return to us approximately 2 weeks later. On this trial, all patients that had cells collected had adequate numbers of KTE-C19 cells manufactured. All patients that were treated received a standardized dose and schedule of fludarabine and Cytoxan. 7 patients were treated, and this therapy was deemed safe. 86% of patients developed some cytokine release syndrome, or CRS. Only one of those patients had a grade 3 or 4 CRS event by the Lee criteria. 100% of patients treated developed some neurologic toxicities. One patient had a grade 3 neurotoxicity, one patient had a grade 4 neurotoxicity. There was one death on study. This patient had an intracranial hemorrhage, and it was felt not to be related to KTE-C19. This patient had been heavily pretreated and had a very low platelet count. Although it's early and only 7 patients have been treated on the phase 1 portion of this study, and the phase 2 trial is ongoing, the overall response rate was 71% and the CR rate was 57%. All CRs that were observed within the first month after treatment. 3 out of 7 patients treated have ongoing CRs at this time. I think this study is important because it's a multi-center study conducted at major cancer centers that do not necessarily have experience with CAR T-cell therapy, and we've shown that this therapy can be given successfully and safely. It's also important to note that all toxicities deemed related to CAR T-cell therapy were resolved within 1 month after treatment.